Assalamu alaikum. Now he's the recurrent UTI. Recurrent UTI, the possibility may due to constipation, due to weeping, backward to forward weeping, holding the pee, extended bubble bath, sexual abuse, urinary tract abnormality, vesicular reflex, PUG obstruction, renal cyst, posterostral bulb, and neurological spina bifida scoliosis. So first of all, just like other history analysis of the presenting complaint, on the scenario there may be that in the last 1 year there is 4 episode of UTI. So will you please explain what is the main concern? And that time she may mom told me to tell that she has 4 attack of UTI for last 1 year. So can you tell me more detail about it? So what was the presentation? What investigation do so far, and what treatment is going on? Does she under any kind of medication? And after this systemic constitutional syndrome is any kind of fever, weight, any concern regarding weight, daily activity. And then the systemic review, neurological system, any weakness, any part of the body, any defect on the back. This is the neurological history. And then the history of does anyone measure his blood pressure, any palpitation, any cough, and then who take care of suppose the child name is Arif. So how frequently he passes the poo? Do you notice the steam of the poo? Detailed poo steam of, how frequently she passed the pee? He passed the pee. How frequent? And do you have any concern regarding the steam of the pee and any painful pee? Do you ever noticed? And how many any kind of bed waiting present or not? Okay. And after this, any tummy pain, any what's about his poo, and is it painful or not? Any ear infection, any skin rash present or not? And does he toilet train, who take care of his any kind, how do you have any concern who wash him after passing of the poo? Do you notice any kind of holding of pee? And after that, the history of the past illness, and perinatal history. Perinatal history is important, is any concern regarding the period when he was in your tummy, any, such as we are expecting oligohydramnion, polyhydramnion, we are focusing on what's about any prematurity present, bath weight, and NICU admission, any scanning done or not, and then dietary history, fluid amount of fluid intake, fiber intake, and then the family history, and developmental history, allergy history, vaccination history, and then family history. Any family history of diabetes mellitus, chronic kidney disease, renal problem present or not. Social history. Any recent change of familial issue? Do you have any concern regarding any kind of sexual abuse? And then after then school history, school toileting, and then social impact of this disease. Okay. And examination, vital sign anthropometry, parabdomen examination, genitourinary examination, neurological examination, and then the investigation for UTI. If it is recurrent UTI and child age is suppose 4 years, so ultrasonography for all, and DIMSA for everyone. And mutating history histogram, if we find in the ultrasonography there is dilatation in the dilatation, poor urine flow, non-E. coli growth, and vesicular tract reflex in the family history. And what is recurrent UTI? We can remember by one, two, three. One pyelonephritis or one or more than one cystitis, or two or more than two pyelonephritis, or more than three or more than three cystitis. One, two, three. I'm repeating, one pyelonephritis plus one or more than one cystitis, or if there is two or more than two pyelonephritis, or three or more than three cystitis. This is recurrent UTI. And a recurrent UTI, and then other. This is the imaging, and we will send the urine analysis for every children. And after imaging, other investigations are urine an investigation along with the imaging dipstick for fresh urine for leukocyte and nitrate and culture, as it is a recurrent UTI. So dipstick interpretation, if leukocyte ST is positive and there is nitrate positive, so it is in case of both of this positive, so we can start antibiotic for the treatment of UTI. So immediate management and the long-term management. Immediate management, as the child is more than 3 months. So coamoxiclav oral if tolerated, or IV for 7 days. But if there is penicillin allergy, we can give the high dose cefuroxime 8 hourly. And then the subsequent management. Subsequent management for we will advise for the prevention of the recurrent UTI. For recurrent UTI, the prevention is maintenance of the hygiene, how to wash after the poo, and there is avoidance of the tight clothing, avoidance of the constipation if present, and treatment of the underlying cause. And there may be the question of vesicoureteric reflex. So in this routine cases, yes, and if in OPD follow-up, we check the blood pressure, which is required especially in case of recurrent UTI, and prophylactic antibiotic. Prophylactic antibiotic required for if there is grade 3 reflux, and there is and the antibiotic choice is nitrofurantoin or trimethoprim prophylaxis. Surgical management. Surgical management, this is depends upon the grading of vesicoureteric reflex. So grading is grade 4 and 5 surgery, grade 1 to 3 follow-up. Grade 1 is urine reflux into ureter. Grade 2 is reflux pelvis and calyx without dilatation. Grade 3 mild to moderate dilatation. And grade 4 is moderate ureter tortuosity. Grade 5 is loss of papillary impression, urethral tortuosity. And the management with renal scar. In case of significant scarring, annual blood pressure monitoring, and female must book early when they are pregnant and inform obstetrician team. If there is bilateral scarring, so annual blood pressure measurement, assessment of urinary protein creatinine and urine function every 3 to 4 hourly, and long-term treatment in the renal clinic. Thank you.